Hello and welcome to Williams Mullen's Benefits Companion, a podcast that helps employers navigate the complex legal challenges of managing their employee benefit plans. I'm your host, Bryden DeWitt, and today I'm covering a pretty hot topic impacting employers: the significant drop in the IRS affordability threshold under the ACA. This should not be news to people, considering this has been in effect since 2014. I believe that we had the first year that we had to enforce the affordability percentage. But the Affordable Care Act requires employers with at least 50 full-time employers in the prior calendar year to offer affordable group health insurance to full-time employees. The ACA defines affordable in terms of a percentage of household income. Premiums charged to employees may not exceed the applicable ACA affordable percentage for a given year. The original affordability percentage under the ACA was 9.5%. Each year, however, the IRS adjusts this percentage. So every calendar year, we have a different affordability percentage. But over the last several years, since 2014, it's all kind of hovered around that 9.5% number. For example, in 2022, last year, the affordability percentage was 9.61%. This year, in 2023, the affordability percentage is 9.12%. In other words, the premium charged to an employee for health insurance in 2023 may not exceed 9.12% of the employee's household income. So, as the IRS does every year, we received recently the affordability percentage that will be in effect for 2024. And it was a bit of a surprise. So, next year, the premium charged for group health insurance may not exceed 8.39% of an employee's household income. That's a significant drop that will require employers to cover a higher percentage of the cost of group health insurance. So, in other words, regardless of what the premiums are, the premiums are always going up from insurance carriers. Employers will also be hit with having to cover a higher percentage of the health insurance premiums in 2024. So that's the law. That's what employers are going to have to do. Well, what can an employer do about it? Well, there's not much, but an employer can consider which affordability or household income safe harbor it plans to use for 2024. I know you use the term household income. When the ACA was requiring the affordability percentage to be applied to household income, nobody really knew, how do you know what an employee's household income is? And so the regulations provided three safe harbors for determining household income. And so the first one is a rate of pay safe harbor. And so basically, you take an employee's rate of pay, hourly rate of pay at the beginning of a coverage period, and multiply that hourly rate by 130. And so that would be the household income that you use for a month for applying the affordability percentage. The second safe harbor is W 2 compensation safe harbor. And so under that safe harbor, you measure the amount of the premiums charged to an employee for a year versus the employee's W 2 compensation. A drawback to the W 2 safe harbor is you don't really know what the number is, what the W 2 number is until the end of the year. But if an employer knows employees are going to be getting basically, if you can accurately predict the W 2 compensation of employees throughout the year, then the W 2 safe harbor often is a good way to meet the affordability threshold because you're kind of using the actual wages received by the employee instead of a guess. And then the final safe harbor is the federal poverty line safe harbor. So household income under that safe harbor is deemed to be the federal poverty line announced for the year divided by 12. And so the way you would figure this out is you take the applicable federal poverty line number, multiplying by the affordability percentage, and then divide by 12. And that gives you the highest amount of the monthly premium that an employer can charge if you're using the federal poverty line safe harbor. Doing that math for 2023, the highest amount under the federal poverty line safe harbor an employer could charge currently is $103.28. That drops next year, doing this math, to $101.94 if the employer uses the federal poverty line safe harbor. So, in structuring premiums for next year, employers should take a close look at these three safe harbors: the rate of pay safe harbor, or the W 2 safe harbor, or ways that you could put employees into different bands of compensation and make sure you do not charge the employees more than the 8.39% affordability percentage for 2024. So that'll wrap up my discussion of this wonderful topic of costs going up under the Affordable Care Act for premiums in 2024. If you have any questions or suggestions for future episodes of this podcast, please contact me. You can also visit our employee benefits page at williamsmullen.com/employee benefits. There you can find out more about our team, as well as past episodes of this podcast and legal alerts. Finally, be sure to subscribe to this podcast to be notified when our next episode posts. Thanks for listening.